75-year-old man is brought to the physician by his son for the evaluation of occasional epigastric pain, nausea, and weight loss for the past 2 months. He has type 2 diabetes mellitus and a history of recurrent episodes of pancreatitis. 10 years ago, the patient was diagnosed with brief psychotic disorder after the death of his wife. Since then, his mental status has been stable. He lives alone and takes care of all of his activities of daily living. The patient has smoked one pack of cigarettes daily for the past 30 years and drinks 2 glasses of wine daily. His current medication is metformin. Abdominal ultrasonography shows a pancreatic mass. CT scan of the abdomen discloses a hypodense and hypovascular mass within the head of the pancreas. Needle biopsy specimen of the mass confirms polydifferentiated adenocarcinoma. When the doctor enters the room to reveal the diagnosis to the patient, he is approached by the son who says, "If it is cancer, please don't tell him." Which of the following is the most appropriate response from the physician? So imagine you're a doctor entering a room with the patient and his son, and the patient just comes out and tells you, "Doctor, if it's cancer, please don't tell him." Now, what is your most appropriate response? So this patient has said that. What will you say next? Option A, "I will respect your wish to withhold the diagnosis from your father." All right. Option A, see, first of all, you remember the rules when it comes to patient treatment. All patients have a right to know their diagnosis, and they also have a right to refuse the knowledge of what their diagnosis is. But if you do not talk to the patient, there is no way that you can know whether the patient wants to know his diagnosis or does not want to know his diagnosis. So when you say, "I will respect your wish to withhold the diagnosis from your father," is wrong unless the patient is mentally unstable or the son has the power of attorney when it comes to healthcare, or has the basically the legal right to dispense healthcare to his father. So when you say A, and they've not said that in the question, they've not said that the son that the son has is the legal guardian of his healthcare or anything like that. They've not mentioned anything like that. So option A is out. "I can help you disclose the diagnosis to your father. He has a right to know." This option B is nice. "I can help you disclose." Yes, that's very right. "He has a right to know." That is also right. He has the right to know. So option B will be in our running for the correct options. Okay, option C. "Can you tell me why you don't want your father to know about the diagnosis?" This also is a lovely option because here it's a question. As I've said, whenever there's a question where you're encouraging the patient or someone related to the patient to know more about their thought process, what is going on in their head, encourage a conversation, encourage a decision, always go with that option. So we have B and C. Then D, "As his physician, I cannot withhold any information about your father's health from him." Correct, true. As his physician, you cannot. Option E, "I propose a psychiatric consultation to assess your father's mental competence." There's no need to perform a psychiatric consultation. Again, referral, getting things off your hand. He's had a brief psychotic disorder 10 years ago. He's been completely fine after that. There's no need for any psychiatric consultation. So out of now, B, C, and D are all partially correct, but C is the best because it's encouraging a discussion, it's encouraging a conversation, it's encouraging more about why the son wants to discuss and not tell his father about the diagnosis. Maybe for all you know, at some point, I mean, you don't know, but you ask him this question: "Can you tell me why you don't want your father to know about the diagnosis?" And then he says, "Yeah, my father has told me just yesterday that he doesn't care about the diagnosis. He does not want to know about the diagnosis, especially if it's something that's cancer and has a poor prognosis." Now, in that case, yeah, you've just understood, you've just heard from the son that this is what the father wants. And then when you go into the room, your next question will be, "I've heard from your son that you don't want to know about your diagnosis when it comes to grave medical conditions. So is that true?" That's the next question that you'll go in the room and you'll ask the father, you'll confirm it. And then if he says yes, then you say, "Yeah, it's fine. Then I won't tell you about your diagnosis because you don't want to know about your diagnosis. And it's your right to not know about your diagnosis if you want to, but it's also your right to know about your diagnosis if you want." So that's how you would approach this question. That's the right answer.
Thanks for watching. Please give a thumbs up and subscribe for more.